Maybe the problem with the prostate isn't really about how big it is. Maybe it's about the kind of cellular environment it's living in. Most of us grow up with a very simple idea. If the prostate gets bigger, symptoms get worse. If it presses on the urethra, urination becomes difficult. The logic feels clean, mechanical, and easy to accept. Bigger structure, bigger problem. And to be fair, that explanation isn't wrong. It explains a lot. It explains why enlargement shows up on scans, why doctors talk about obstruction, and why size measurements matter in clinical settings. But there's something about real life that doesn't line up neatly with that story. Some men are told their prostate is enlarged and feel almost nothing. Others are told the enlargement is mild, yet their sleep is broken night after night, their urinary flow feels weak, and their body never quite relaxes. If size were the whole story, those differences shouldn't be so common. So the question quietly changes. What's changing when the size stays the same? One way to look at this is to stop focusing only on structure and start thinking about function. Not what the prostate looks like, but how the cells inside it are actually living day to day. In one theoretical way of seeing things, an organ doesn't work in isolation. Its cells constantly respond to their local environment. How well blood reaches them. How much oxygen and nutrients arrive. How chemical signals move from one cell to another. How much stress those cells are under. From this point of view, cells aren't machines that simply sit there because tissue exists. They're responsive. They adapt. When the environment supports them, function feels smooth. When it doesn't, efficiency drops. The prostate is especially sensitive in this sense. It's dense tissue, rich in supportive cells, and highly dependent on local blood flow. Small changes in circulation or signaling may not change its size at all, but they can change how the tissue behaves. When the cellular environment becomes strained, cells may shift into a kind of conservation mode. They do less. They repair less efficiently. The tissue still looks similar on imaging, but function begins to feel different from the inside. Seen this way, enlargement may not always be the starting point. It may be something that happens later, after long periods of imbalance. A visible marker, not the first domino. This doesn't mean the standard medical explanations are wrong. It just means they may be answering a different question. They describe what can be measured. This perspective asks what is being experienced. And that difference matters, because symptoms are lived, not scanned. So maybe prostate discomfort isn't only about how much tissue is there. Maybe it's also about how well that tissue is being supported at a cellular level. And once you start thinking that way, the problem looks less like a simple size issue, and more like a question of environment.